Hello there. My name is Kyle Morgan. Today I will be telling you about amyotrophic lateral sclerosis, also known to the world as ALS. So what is ALS? Basically, it is a progressive nervous disease that affects the nerve cells in the brain and the spinal cord and causes loss of muscle control. It's also known to a lot of people as Lou Gehrig's disease after the baseball player many years ago who was diagnosed with it. And it is also the disease that the famous Dr. Stephen Hawking was diagnosed with as well. So, how does ALS progress? Basically, it starts with a bunch of muscle twitching and weakness in your limbs. It also leads to slurred speech, and it gets to a point where you won't even be able to, people won't even be understand what you're saying. It also affects the control of your muscles that are needed to move, speak, and breathe. And the disease is totally fatal and has no cure yet. So some of the lasting effects, the most common one is breathing problems. A lot of people have died, usually die from ALS because of respiratory failure, and it's because the muscles that are used to breathe, they're paralyzed. So some patients may need to be given ways to help them breathe, such as continuous positive airway pressure. Another problem people have is with speaking. As I said before, ALS leads to mild slurring, and then it gets to a point where people won't even be able to understand what you're saying. Then you have eating problems because it also affects the muscles that are used to eat. So it can lead to malnutrition and dehydration. So one of the things you might need is a feeding tube to help reduce those risks and make sure you are getting properly hydrated. ALS also leads to a certain type of dementia called frontotemporal dementia, and that is where you will start to have problems with memory and decision making. So some of the symptoms that we see, they happen all over the place. So you have impaired speech, you can have excess saliva, difficulty swallowing. In terms of your breathing and respiratory, you have shortness of breath, restricted breathing, and difficulty sleeping. In your upper body, you have weakness in your limbs, weakness and pain as well. You have a very limited range of motion. Your upper body will spasm a lot. You'll have trouble dressing yourself as well. Your handwriting will probably be impaired, and you probably won't be able to prepare your own food as well. In terms of your lower body, there's also some weakness down there. You might have difficulty going upstairs because your legs will be hurting, things like that. A lot of people with ALS have trouble with balance, so you'll see them staggering themselves, tripping all over the place. So there's a good amount of risk factors for ALS. In terms of the general established ones, there's heredity. Uh, in terms of heredity, about 5 to 10% of ALS patients had inherited it, and children of ALS patients have about a 50-50 chance of getting it as well. In terms of age, the risks definitely increase with age, and it's most common between the ages of 40 to 65. In terms of sex, it is a lot higher risk for men under the age of 65. And then for anyone from the age of 70, the risks are equal no matter what sex you are. And then there's also genetics. People are doing a lot of research about how ALS affects genetics, determining whether or not familial or non-inherited ALS can lead to someone being more susceptible to the disease. Some environmental risk factors. The top one, obviously, with a lot of disease, is smoking. It's a lot higher in women, especially after menopause, too. Then there is toxin exposure. There are some work environments that people work with specific chemicals that could have some links to ALS. And now a very special one that was recently put in the news was a link to ALS patients in military service, where there could be some situations where people who served were exposed to different chemicals that could cause a trigger to develop ALS and also possibly had some traumatic injuries or viral infections that also led to some triggers as well. So, ALS is a very hard disease to diagnose, and the two top ways that doctors like to find out about it, to find anything early, is either through an electromyogram or a lumbar puncture. And since ALS is a non-curable disease, there are many ways to treat it. For the most part, there are medications, but for the most part, they're not all that helpful. So what what you should do if you have ALS is therapy. There are lots of different types of therapy that you can try that would help. There's breathing care, where you might get your breathing regularly tested to make sure that you're breathing right, obviously. Then there's physical therapy, where you can address the pain and walking, your mobility, bracing, and find equipment that you may need to help you stay independent. And then there's occupational therapy, where you can find help to remain independent despite the weakness that you're getting in your limbs. And an occupational therapist can also help you modify your home in ways that will help you walk out throughout your home and make sure things are easy for you. And then, for the most part, you also need speech therapy because, as I said before, you'll have problem with talking. There are a lot of different styles of communication that would help, and a speech therapist will help you with that as well. You know, you'll be able to explore tons of different types of communication that will help you talk to the people around you because you'll definitely need that help. So here is a case study that I took over on a patient who is a 23-year-old male. He started feeling cramping in his legs. He feels pain when he goes upstairs, when he's running and walking around, especially if he's going long distances. His pain is alleviated by a massage or with rest for the most part. He noticed a change in his voice. He's probably starting to get that slurred speech. Uh, he was a very friendly guy, um, but his spirit was pretty low after he got diagnosed. He explained in our conversation that he noticed a very big change in his body image after he was diagnosed. The most notable was that his muscle mass had decreased very significantly, and his current functional status is fairly below average. He has a problem with a lot of his daily activities in his house, but he still doesn't need any mobility device, which is still a good thing for now. So, since ALS is not very tolerant of very hard working exercise activities, you gotta sort of stretch out what you can do. So, since he is ALS, we wanted to really work around the limbs and his breathing. So, we worked on global strength. So we worked with his wrists, his hips, and his knee, seeing how strong he still was. For the most part, they were pretty average. Um, he hadn't completely deteriorated yet, which is very good. His wrist flexion was a little below average, though. His grip strength, his hands are definitely starting to deteriorate. They were pretty below average. His range of motion wasn't terrible. Um, he has some pain when moving some of his limbs. His fingers were pretty low. His ventilatory strength is fairly low as well. He has started to have problem with breathing. And then we also put him through the ALS functional rating scale, which is basically a test where you see what a person can do with different common daily activities. He did pretty well. The highest rating for the test generally is 4, and he did fairly average for most of them. Did very well with a good amount of them. So he hasn't fully deteriorated yet, which is very good for now. So his exercise prescription is very specific because we had to make sure he didn't do anything too crazy, but we still wanted to test him, make sure that he kept up with his strength as long as possible. In terms of specific strength exercises, we had to work the specific limbs exactly, making sure he can still work his ankles, his wrists, his glute muscles, his all his upper leg muscles. Those were those were the main points that we wanted to go through. So um, his intensity wasn't too high. We made sure he stayed in the 70 to 80% 1 RM range. Did about 2 to 3 sets to 8 to 12 reps. Best to do about 3 times a week and make sure he had about 48 hours of rest between the same muscle group for each time. And each workout probably lasted about 60 minutes with about a 2 to 3 minute rest in between. In terms of endurance, we couldn't, he can't sprint or do anything crazy like that because the weakness in his legs is too high. So, putting him on machines like the elliptical, arm bike, and treadmill is the best way to have him work. Can't have him go super intense on him though. Had to make sure it was still moderate. And it's best to test his breathing at the same time, so try to have a conversation with him while he was on the machine. Make sure he did about 3 times a week for about half an hour a day. Since ALS also was affecting his coordination and balance, we had to make sure he kept up to date with that. So we got him some exercises that made him stand on a leg, one leg, a tandem stance where he was switching. Make sure he could stand on a surface that will make him really have to try to balance himself out and see how well he held himself up when he was leaning against something as well. So, wasn't really a easy way to test that, so just had to do it until he couldn't do it anymore. Easy thing to do. Then, of course, like every good workout, there was the stretching. We had to make sure he was stretching out the specific parts that his ALS was really affecting him on. So we worked his fingers, his wrists, worked his lower and upper legs, and we also worked his shoulders as well. And it was just best to have him hold the position until he felt some moderate discomfort. So, in conclusion, this is really what I want you to know. I want you to know that ALS is no joke. People who get this die. And if you're unfortunate enough to become a patient with this disease, do your research because it's very important that you know how to take care of yourself and that people around you know how to take care of you as well. And here are my resources.